Hi, this is Dr. Gina Tizio. I want to start off by saying this site is not meant to provide medical advice or health advice of any kind. Do not misconstrue any information that you read here as medical recommendation, diagnosis, or treatment. The information provided here on this website is intended to serve as a landing site for our services, a means of contact for our practitioners with our clients, and communication of our experiences and share articles and public material pertaining to health that we are called to share. It should in no way be interpreted as medical advice of any kind. Affiliate links may be included in this posting. Today, I want to talk a little bit to you about informed consent, especially in the realm of semaglutide and tirzepatide, because uh, generally, when you go in and see a doctor and get medications like this prescribed, you should get something called informed consent. At some point in time, I'll come back and talk to you about informed consent and what all that entails. But for right now, one of the most important aspects is before they prescribe this medication, they should be running labs. They also should double check to make sure that you don't have multiple endocrine neoplasma type 2, no personal family history or personal history of medullary thyroid carcinoma, and you also should not have diabetic ketoacidosis. Even though those are the contraindications, meaning this is a medication you should not be taking, there are a lot of other things that you should be told about when considering taking this drug. People are using it a lot now. It's recently approved for weight loss, and I'm seeing a ton of people losing weight. It's really awesome to see people losing weight. My personal issue is that losing weight this quickly is not good and it's not healthy. Some of the people I've seen actually the weight loss is so much they look like a totally different person. Weight loss is very good, but it should be done slowly over time. You didn't gain the weight overnight, nor should you lose it overnight. And I personally am in the process of losing weight myself. And at some point in time, I'll go over my personal journey with that as well. But even though my doctor wants me to take semaglutide, I have refused, partially in part and due to some of the things I'm going to bring up today in regard to informed consent. Side effects is something that should be discussed when a patient is starting a new medication or regimen, surgery, any kind of medical procedure, that type of thing. They should go through all of the parts of it, what's going to happen, what are the alternatives, what are the risks, and always ask if you have any questions. With semaglutide in particular, we're seeing a very interesting side effect called gastroparesis. If you are not a healthcare practitioner and you know what gastroparesis is, my heart goes out to you. It's not a good thing. Gastroparesis basically means that your gut does not contract like it's supposed to. It does not move poop and it does not move food. And what ends up happening is all that poop just builds up inside of you and stays in you. And so if you have chronic constipation, meaning you regularly are not having bowel movements and that type of thing, gastroparesis is one of what we call the differential diagnosis. It's one of the things that we should be looking at treating to see if in fact you have it. Now, being that gastroparesis or slow stomach emptying, slow bowel movement is one of the things happening with this, the reason it's of concern is partially not because it is, but because usually when you get a side effect from a medication, the side effect is reversible once you stop taking the medication. For instance, one of the most common ones I encounter is lisinopril. Lisinopril has been on the market an incredibly long time. I use it when I need to because it does a pretty good job of lowering blood pressure, and What I always tell patients when I first start lisinopril and I'm doing my informed consent is I explain to them that probably 1 in every 10,000 patients ends up getting a cough severe enough from lisinopril to make you want to take them off the drug. So most people, about 25% of people will have like a little cough when they start lisinopril. They keep taking it, and within a month or two, either the cough is gone or they've gotten so used to the cough that it's negligible until we can reach their other whole health goals, which hopefully include losing weight so we can take them off the lisinopril. However, this isn't what we're seeing with semaglutide. It is really scary because the gastroparesis is non-reversible, meaning you take them off of semaglutide and the gastroparesis continues. This is very detrimental to the health. What you're going to find if you continue watching my channel is, as I do little blasts and kind of explain how the body works, what you'll see over time is that gut health is the basis of health. If your gut doesn't operate the right way, nothing else in your life is going to be okay. Nothing. And so even when I go to treat a patient naturopathically, that is the first thing I look at is what is their gut health. And I try to go through, and depending on what's going on, because there are so many medical conditions that go on with the gut. And it's funny, I saw an article that basically talked about how for most medical professionals, you've either got heartburn or you have IBS, and those are the only two things that you have. But that simply isn't true. We can go over that more later. There are more starting to wake up and realize that your microbiome, meaning the probiotics that live in your gut naturally, have a big part of it. So that's starting to come a little bit. I've even heard of MDs prescribing probiotics now, which is fabulous because for a very long time, that's not something they would do. So that gastroparesis is a huge concern of mine. It's something that I really would wish that more people understood about it and the significance of that. Now, the gastroparesis can get so severe you can end up with a blockage in the gut and end up needing to have surgery. And it depends on the blockage. I'm not a surgeon, but I can tell you having a blockage in your gut is, really bad. That's a surgical fix. That's not something that it's a medical emergency. That's a go to the hospital type of thing. The other thing that I wanted to bring up about semaglutide is that 1 and 0.5, so half of every person out of 100 is going to develop elevated platelets. What does that mean? Elevated platelets, we get really worried about that as healthcare providers. The higher your platelets are, the more likely you are to have a heart attack or a stroke or some other what we call cardiovascular events, which are heart attacks and strokes. And heart attacks and strokes, just to lose a few pounds. And yes, semaglutide is being used, and other drugs in its class are being used in the treatment of diabetics. It is wonderful for lowering glucose levels. It seems like a magical bullet for insulin resistance, which is really the underlying issue. But even deeper than insulin resistance is mitochondrial dysfunction, which is for another podcast. Just trying to draw you in, hoping you'll continue watching. So when you have elevated platelets, it's not good because we don't want you to have a side effect as serious as death. If you're taking semaglutide, it's just not worth it. So there are probably other things that I need to go over with you, but I'm going to leave you with that. Whenever you take a medication, always be sure that they're going to tell you the contraindications. Ask and make sure you're not allergic to it. Make sure you don't have any of the contraindications. They should go over any alternatives. They should talk to you about the risks, tell you right up front what they are. You should know before you start taking a medication what they are, and have the opportunity to ask questions. Thanks for tuning in. Have a great day.